the Summerly Dental YouTube channel. My name is Dr. Taha Jomha. On today's episode, I'm going to be explaining why your tooth might need a crown. Please like and subscribe to support this channel and to stay up to date on everything related to oral health. There are many different reasons why a tooth may need a crown. I break it into two categories. The first is crowning for aesthetic purposes, and the second is for protection. The first category involves cutting down a healthy tooth in order to change the look or the color of that tooth. I'm not going to be talking about that in today's video. The second reason is to crown a tooth in order to protect it against breaking or future loss. I'd like to briefly describe what a crown is. A crown is like a cap or a cover that goes over a tooth. The dentist starts by preparing the tooth and reducing it so that it's smaller. We then will take a scan or an impression and send that off to a lab or have it milled in our office. Once the crown is placed, it provides an all-in-one solid piece of protection against biting forces. There are various different materials that can be used to fabricate these crowns. In my practice, the most common materials are going to be gold, emax, and zirconia. Each material has a specific function and there are pros and cons to each one. This is something you should discuss with your dentist before having the tooth crowned. In my practice, there are three main reasons I recommend crowning a tooth. Those are root canals, cracks, and large restorations. Let's start with root canals. A root canal is a procedure whereby the dentist removes the nerve from a tooth. Typically, this is due to an irreversible inflammation caused by a deep cavity, a crack that extends too far, or when the tooth is abscessed. After a tooth is root canaled, it is generally going to be weaker and more prone to fracture. This is in large part due to the fact that most teeth that need root canals to begin with already had large restorations or cavities. If the tooth was cracked before the root canal, it's inherently weaker. There's also some studies to suggest that performing the root canal procedure will dry out the tooth and make it more brittle. Crowning the tooth offers a solid one-piece layer of protection against biting forces in the mouth. Another important part of of crowning a tooth that's been root canaled is it provides a seal against new bacteria from entering and reinfecting the tooth. Root canals aren't the only reasons why we crown teeth. Sometimes if there's a small crack that doesn't extend too far, this could result in a tooth that is sensitive to both biting and to cold. In cases like this, the tooth would benefit from simply just a crown, no root canal. However, if that crack does extend further down and into the nerve, your dentist will want to do a root canal first and then a crown. There are various tests that we can do to determine which of those two scenarios you may be. The final reason I would recommend crowning a tooth is if there's a large restoration or filling on that tooth, typically one that's covering the cusps of the teeth. The cusps are the working parts of the teeth, and these are the areas of the tooth that take the most force when we're chewing. Unfortunately, filling material just isn't strong enough to withstand these strong forces. A crown can be made from a much stronger material, and it's one solid piece that can be used to distribute those forces. Sometimes when only a cusp of a tooth is missing, I also may recommend doing an onlay or a 3/4 crown. In all three cases, crowning is all about preventing fracture. Anytime a tooth breaks, there's always a risk that it could break beyond repair. Crowns do tend to be a more expensive option, largely in part due to lab fees involved. However, the upfront cost of crowning the tooth is going to be less than the long-term cost of replacing a tooth. Usually after we discuss the cost of a crown, the most common question that I get is, how long can I expect my crown to last? There are many different factors that can affect the longevity of a crown. In my practice, I've seen crowns failing as early as 1 or 2 years, and I've seen them lasting 25 plus years. The rule of thumb that I like to tell patients, you should expect your crown to last a minimum of 10 years. It is important that you seek regular dental x-rays and cleanings in order to identify problems ahead of time. Also, if you have multiple crowns or if you grind or clench your teeth at night, it is advisable that you wear a splint or a night guard to protect your teeth and crowns. Lastly, I'd like to say a few things about gold crowns. In more recent years, gold crowns have become far less popular than the more natural looking alternatives such as emax or zirconia. And don't get me wrong, these are great choices for crowns and I use them all the time in my practice. However, there's something about gold that I just find it tends to be stronger and long-lasting, especially when placed on the very last tooth in the mouth. For most patients, it's not going to be in their smile line, and the only disadvantage is it's gold in color and it can be a little bit pricier than a traditional emax or zirconia crown. This is something you should discuss with your dentist. I've never had a patient not happy with their new gold crown. I hope you have a better understanding of crowns. If you enjoyed this video, please like and subscribe to help support this channel. Thank you for joining us. I'm Dr. Taha Jomha, and this was the Summerly Dental YouTube channel. Until next time, thank you.